SAMSA, and we are glad to present a series where people can interact and hear the thoughts of somebody who has already completed their residency in a particular specialty. And we the aim of this entire thing is to help people decide on what specialty they should take and whether they should probably take a particular specialty or not. So thank you so much, Paramadi, for joining us. So just
Yeah.
a quick introduction to Paramadi for everybody. uh, Dr. Paroma Mukherjee has completed her MBBS with an honors and completed her MS in ENT, that is Otorhinolaryngology, um, from Medical College and Hospital, Kolkata, with very shiny, I'm supposing, gold medal, Didi. So thank you so much for joining us today evening.
Thank you. I think SAMSA is doing a very nice, this is a very good idea by conducting these sessions with the residents. So, I wish this happened when we were waiting for our counseling. So we just get a perspective of the residents as to, how they look at their residency and at the subject. So this is a good idea.
Okay, Dee. So let's quickly begin since we're already
Mm-hmm.
around 15 minutes late. Uh, we have all read ENT in our third years as a subject, but
Mm-hmm.
exactly how is it? How vast is the subject? And I mean, what is it like to take up residency in ENT and just study ENT for the rest of your life?
See, the ENT we read during our MBBS days. So that was from Dhingra mostly and about ear, nose, and throat. So that is the idea which I had when I joined residency. But then there's a lot more to this subject than just these things. So the most important part is the head neck part. So here in ENT, it's also about skull base and the head and neck surgery, which is a huge portion of the subject during our residency period. And the good thing about ENT is, you have a medicinal aspect to it and as well as a surgical aspect. So those who are inclined towards medicine and can also think about taking up ENT as one of their specialty subjects, and surgery definitely, because you get to do a lot of surgeries and the training is also very good. It's very interesting.
Okay, so that is very nice to hear. But then, exactly how rewarding is ENT as a subject during residency, and if somebody has just completed MSc ENT?
See, once you complete your MS, you are getting the degree, but there's a lot more to learn post the course, because surgery is something which, as you gain more experience, your surgical skills become better. During your residency days, it depends on the college you're doing your post graduation from, and the patient turnover. So definitely in any super specialty medical college, in the medical colleges in Kolkata or in the big cities, you will get a lot of scope. And during your residency, see, in ENT as such, if you ask me about the emergency cases, the emergency cases we get is a tracheostomy. So then, when you have a patient desaturating and you do the procedure, the satisfaction is good, because you just save the patient from, a very, you bring him back from death, you can say. So from saturation 8% to 100% saturation, that's a good feeling. And you have these other emergency procedures. They vary from college to college, but esophagoscopy, bronchoscopy, these are also there. And of course the routine surgeries.
Okay, so since we are talking about surgery in so much of detail,
Mm-hmm.
there are a lot of us who have thought about taking up surgery as an option. But what about the people whose ranks are not enough to get them a seat in general surgery? And
Mm-hmm.
do you think we should think about taking up MSENT instead of general surgery?
Yeah, definitely that's a good idea, because if your rank is, say, in the middle zone, you can consider ENT as one of the subjects next to general surgery, because here you get a lot of exposure in surgeries. You can do parotid surgeries, you can do thyroid surgeries, or you can get a lot of cutting opportunities. So I would recommend ENT as one of the subjects after surgery. If you're not getting general surgery as one of the options, ENT can be an option.
Okay, so since what college we are in or what hospital we are in plays a very huge
Mm.
role in, I mean, the patient exposure and the cutting opportunities, like you
Yeah, yeah.
said. So, exactly how should somebody choose a college other than probably the factors like how close it is to home or whatever it is? So, other than those opportunities, other than those factors, what exactly should we consider while looking for a college?
See, one thing which we must find out before choosing the college is whether that college has a running ENT emergency present or not. Because if an ENT ER is not present, you get to, not do a lot of cases, which as residents we got to do. Say, these esophagoscopy and bronchoscopy procedures, if the instruments are not available, if you do not have a round the clock anesthesia team, who can come and help you give the drugs and administer anesthesia, then you cannot function without a full ER setup. So a college which has a running ENT ER, that is one factor which must be kept in mind, because if you do not have any emergency services, then it's no fun, like because you go back home and during the ER period, when you're in your college in the ward on ad days, you get to do a lot of cases and you get to learn also. So that is one factor which has to be kept in mind. Second is instrumentation. See, ENT has got microsurgery as one of its parts. So we need microscopes for tympanoplasties, for the basic, for all ear surgeries. We need a working good microscope. And endoscopes are also available with proper monitors. So if that is not there, the advanced surgeries cannot be done. So we must inquire whether the college where you are planning to take up your residency course has these instruments available, because without these instruments you cannot do most of the surgeries. And these two things should be considered.
Okay, that is something that is very interesting. Uh, exactly, what exactly would fall under the emergency cases of ENT? Because other than tracheostomy, probably esophagoscopy and bronchoscopy are also performed under maybe GI or pulmonology in other colleges. So does it vary from college to college, or what is the
No,
scenario?
see, like foreign body esophagus is mostly done by the ENT surgeons, and these are all emergency cases where you need to administer GA and get an esophagoscopy done, a rigid esophagoscopy or a flexible one, if you have it, and a bronchoscopy also for a diagnostic purpose. We have pulmonary medicine doing it regularly, but to take out foreign bodies and that expertise, I think it falls under ENT category. So mainly these three things as emergency, and of course the foreign body things which come impacted in the nose or elsewhere, that is also included in our subject. But these we can do under local anesthesia unless it's a very small kid and we cannot take it under vision. Then we have to go for IV sedation or general anesthesia. But otherwise, these things can be done in the ER with some basic instrumentation. But esophagoscopy and bronchoscopy, definitely it's done by ENT surgeons.
So, Didi, since we are
Mm-hmm.
talking about choosing ENT,
Mm-hmm.
what made you choose ENT?
See, I'll tell you honestly, from when I appeared for my post graduation exam entrance test, I had in mind that I would be taking up medicine. I always loved reading the subject and it intrigued me. So when ENT came as one of my options, in fact, one of my teachers, I spoke to him before the counseling session, and he told me about the prospects which ENT holds for you in the future. So as I said, ENT has a medicinal aspect to it as well. Nowadays, neuro-otology, it's one of the big things in ENT where, we discuss about so many problems which, surgery cannot cure, and definitely it's not under medicine's domain. So if you want to practice medicine, you want to read about the subject, know about the subject, then you can pick up ENT. And of course, you can hone your surgical skills here. The head and neck part, the skull base part, Everyone speaks about taking up orthopedics or general surgery because they do get to do a lot of cutting, but the precision you need is required in ENT, because when you are, dealing with fine structures, fine nerves, you have to be precise, and there your surgical skills are very important. In India, ENT comes as a subject where, मुझे अगर ये नहीं मिला, so I'll take up ENT. Okay, my rank is not, in the top 1,000, in the top 2, 3,000. So I'm not getting the subject of my choice. That is why, I'm considering ENT. But, in abroad, a lot of people take up ENT as their first preference because of as I said, so many aspects which ENT has. It's a huge domain. Robotic surgery, skull based surgery, all these are upcoming branches, which you can think about after completing your MS.
Okay, so since we're talking about after completing our MS, exactly what are the fellowships that are being offered in India or maybe in abroad places, or what about the further super specialties that we can do here in India?
In India, if you're considering MCH, you can think about plastic surgery, which right now is in some in the central institutes. And you can think about doing head neck surgery. Recently in Kolkata, SSKM has opened up four seats for MCH head neck surgery, and we are eligible for that. So if you want to do MCH, you can think about oncosurgery, head neck surgery, and plastic surgery. And fellowships, there are a lot of things. If you want to specialize in otology, there is cochlear implantation, where there are a lot of fellowships happening in India and outside India in the European countries. So that is there. If you're thinking about rhinology, the cosmetic part, rhinoplasty, where we are all very concerned about how our face looks. So these facelift surgeries, these rhinology to maybe correct a deformity in your nose. All this is there. This itself is a super specialization after ENT. So that is there, and specializing in thyroid cases, endoscopic thyroid surgeries, all that is also there.
Okay, so do you think that there are any special personality requirements for somebody who is planning to take up PNT?
Personality, you just have, once you join the subject, you have to start liking it. You must think that, SNA, because I did not get something else, I'm taking up ENT, or it should not be forced. Then if you like it, you take up the subject, and of course with residency there are ups and downs, so you just have to go with it.
Okay, so what is life like as an ENT resident?
I have, enjoyed my life as a resident in ENT because, it's not as hectic as the medicine and surgery subjects, and yet we get to learn a lot of things. We get to do temporal bone dissection, so deal with cadavers, we deal with patients. The patient load in our hospital is crazy. You get to see a lot of textbook cases, and of course, you get to operate as well. So there's a balance, it's not as hectic as the heavy subjects, and yeah, you get to go home, read up on the subject, come back, and implement your learnings there. So that gives you time.
So can we say that if somebody is interested in probably a very good subject like say medicine or surgery, something that demands a lot out of a person, but somebody is not ready to put in so much of their time into just their career or probably just working long hours, would ENT be a good option for probably them?
Yeah, once your residency is over and you are through with the struggle period, the life in ENT is very good because it's balanced. You do not have to work for say 16, 18 hours a day, and yet you get to do good surgeries, you get to see a lot of patients, interact, and have a good personal life as well. But mostly you have to have a passion for the subject, otherwise it would be very difficult. If you like it, you can take it up, and then yeah, it's a good thing, it's a good balance between your work and personal life. It's a good balance.
So, regarding super specialties, is it absolutely necessary to do a super specialty, or like Is there any dearth of patients in ENT after MSc only?
See, that depends on, your practicing skills. There is not a dearth because there are a lot of the patient load in India itself is so much that you will not be lacking patients. But yeah, if you do super specialize, not necessarily an MCH, but you can go for these fellowships because these give you specific training in a particular subject. So even after doing ENT, we break up, say, we some specialize in otology, some in rhinology, some in head neck. So then you can branch out from doing ENT. And if you do not want to super specialize and practice ENT as a whole, that can also be done. But yeah, it's better to branch out, pick up your subject of interest. During your 3 years, you get to, see all the three aspects of this subject and then decide which one you want to work with. MCH is, at this stage in India, maybe MCH is not necessary. MSENT would do, but I would recommend people to go for fellowships after this because you get more training.
So, talking about work-life balance here, uh, what are like? Do you think that there is a high risk of burnout in this situation? Because there are some people who join in the first year of residency and then just immediately drop out. Is that because of the subject, or is that because of the wrong decision, or is it because of the burnout?
Well, that in ENT is very less. I haven't heard of many students doing that, but I guess it's because they didn't, they took it up because they wanted to try their luck and, take the exam again next year and maybe drop out. But otherwise, ENT as a subject is very balanced. It will not, create a lot of mental pressure on you that, you have not learned things or you're not getting time for other things in life or you're not getting enough patience, you're not getting to see a lot of cases, you're not getting to do a lot of cases. That doesn't happen in this subject. So I can tell you my outdoor goes on till 3 4 in the afternoon, and after that emergency is always packed with someone or the other coming in. Life saving cases, yeah, definitely they happen maybe 3 4 times a week, not every day, but yeah, that's there.
So, do you have to do an OPD and an emergency every day, or is it branched out in forms of different days?
No, see, that will depend on which college, which department you're going. In medical college, there are 3 units, so we can divide into 2 OPD days. So OPD is followed by your emergency day, like in any other subject. We have 2 OT days. So the cold cases are kept the day after the OPD, and we have 2 days called cool days, which are where we go for rounds and see the post-op patients and do the necessary ward work. So there are 2 days a week when we are managing the emergency, the respective units, and Sundays are by rotation. So there you just see the emergency cases which come, tracheostomy, esophagoscopy, and bronchoscopy being the main cases, and of course the small foreign body, foreign body nose, and other things.
All right, that makes a lot of sense. So, what do you think could be the timeline of a ENT specialist to like establish themselves as a consultant?
Okay. Uh, See, I have to figure that out, as the time goes. But maybe I'd say give yourself a total 10 years time. 10 years down the line, you should be having a good career. So after you complete your residency, you have this time where you can work in different medical colleges or in hospitals if you're not under the bond. Or even if you are in the bond, I think that's a good thing because there, in whichever college you're posted in, there you get to deal with the ENT patients and, of course, hone your surgical skills. After that, parallelly, you can start your own private practice, or if you want to go for fellowships or MCH, you give yourself that time, say 3 years, to do these things. Fellowships, some are for 2 years, some are for 6 months, 1 year. You pick out, what subject you want to specialize in, you apply accordingly, and you go and learn. So 3 years of another 3 years of learning, you should give that time to yourself. So by the end of 6 years, you know quite a lot about the subject, and of course parallelly you do your own practice and grow and mature as a surgeon.
Okay, so do you think there is a difference in doing an MS in ENT versus a DNB in ENT?
DNB, doing DNB from a private place, I would not recommend that because in private places, I have got a few colleagues doing ENT from private nursing homes or hospitals. There, you do not get to do a lot of cases on your own. Definitely, you get to see patients, but their consultants do the surgeries, consultants, do everything. You do not get to sit in the OPD during your DNB tenure. You have to stay in the ward, manage the cases, and maybe once or twice you get to do some surgical training. But yeah, DNB is equivalent to MS. Primary DNB is equivalent to MS. But for ENT, I would recommend you do an MS from a government setup or a college which has got a good load of patients.
Okay, so then this makes a difference in the skill set of the surgeon, right?
Pardon, what?
This does make a difference in the skill set of the surgeon.
It does, yes. Because you're giving 3 years of your life to the subject and you're getting a degree at the end. But if you're not that satisfied as a when you graduate, of course, as a consultant, then again that another 3 years you have to add to your practicing your honing skills. So the institute is very important. I have seen a lot of colleagues, so they are not very happy doing DNB ENT from private places.
So, regarding super specialty after say MS or DNB, does your putting on like does your degree of whether you've taken an MS or a DNB does that make a difference
No, it
when
doesn't.
somebody is applying for specialty, super specialty? Sorry.
Uh, if it's MCH, then you have to appear for NEET SS or INI CET, whichever you're planning on taking. But for applying for fellowships, it will not make a difference. No. There are interviews, your knowledge, in DNB at the end of 3 years, they do test your surgical skills by questioning you, how much you have learned during the practical parts that is in the OT. And so that if it's not that solid, it's very difficult to crack the exam. So I have got a few. The medical college was one of the DNB centers, so I would see candidates coming. Maybe again, I have third try. They are coming for the practicals. They're all from private institutes, and that basic practical things. The DNB questions are very direct, but if you have not experienced them, if you have not seen that process being done, the procedure being performed, it's very difficult to answer those questions. So in ENT, the institute is very important. For all surgical cases, I would say ENT definitely is. Because if it's a microsurgery, you have not seen it, you have not done it. Then if I ask you a question about how it's done, those small tiny details, it would be very difficult to, answer. If you do not see the mind doesn't know what the eyes have not seen. So that is there. That is there. Hmm. You have to find out whether the setup there is good and who your mentor is. If you have a good mentor there and you can get your arrange for your own instruments, your mentor is good, wants to teach you, then you can go for it. And you have to be proactive in your residency life. You have to show that you want to learn, you want to do surgeries. You have to go assist. Maybe there'll be time and you'll not get to do a lot of things except assisting, and you'll feel like, what am I doing here in a surgical line if I do not get to perform surgeries on my own? But uh, when you assist, you get to learn a lot of things. So with that, gradually, eventually, you'll get when you perform the first surgery, you'll understand that because I had assisted in so many surgeries, I know this right procedure. So a mentor is very important. But if you have a running emergency in that hospital, a running ENT emergency, you can consider taking up the subject. Yeah, it's good. It's good. You see, if you're a good doctor, if you are a good practitioner, I, like I said before I joined ENT, my mentor, he spoke to me for half an hour, and I knew, yeah, I should be taking up this branch. And I am very happy and grateful to my teacher for guiding me like that. Yeah, it's good. The monetary satisfaction is definitely good. That is applicable for all branches. If you're a good surgeon, you make a good name for yourself. Initially, of course, it's a tough period for all of us, because why would someone come to a novice surgeon? They would go to experienced surgeons. But once you have established yourself as a good surgeon, you will get to do a lot of cases, and the patient turnover is quite good. Cons, see, what I still hear is, people take up ENT because they are not getting out other branches, and इसमें क्या है, ear, nose, throat, ear pain लेके आ जाता है. So I think that awareness the pop, among the doctors, I would say, is still lacking. So that has to be improved, because patients, you will get you we see so many patients, and you provide that you can see benefits very fast. When you do a thyroid surgery, within a month you get good improvements. For surgery, for onco surgeries, these onco surgeries are very common in, the head neck region, and we do these surgeries. They are very satisfying when you see, your patient comes for a follow up after 5 years and he's doing fine, absolutely fine. So that satisfaction is also there. So the awareness among the young group, the young doctors, that has to be improved. So that is something I think we need to work on. Yeah, I'll tell you about. You have heard about mucormycosis, right? So period 21, when the second wave had started, there was an influx of patients with plaque discharge who had lost vision in one eye, and it's very rapid, the changes which happen during mucormycosis. And when you look at the patient, you think, no, the mortality rate is very high. But during that period, say in 1 month's time, we had operated on more than 30 cases. We lost 2 3 patients, of course, due to other medicinal complications, but these patients still come back to us for follow-ups. Maybe somebody has an orbital implant now, but all these patients are doing fine. So when these patients come, it really makes me feel satisfied. Because at that time, when there was a dearth of amphotericin B, and the complications with ampho B, we had less manpower, and the number of cases who were coming with post COVID mucormycosis, even some were COVID positive. So we had to operate with limited staff, with PPE kits and everything. And it was a new domain for all of us. We had not operated on so many cases before. So that was an unknown area, but the results were very good. The results were very satisfying. Yeah, yeah, yeah. Absolutely. So many post-COVID complications which, happened, anosmia, tinnitus, mucormycosis, all that. So we are still dealing with those complications. We still get patients in the OPD complaining of anosmia, parosmia, all that. Maybe they had COVID during the first wave during 2020. So those are there. And of course, mucormycosis played a very big role. But yeah, the results were very satisfying. So when you definitely get to do some life saving procedures, and of course cosmetically satisfying, because if you have a whole part of your cheek gone, reconstructing that, so all that is there. This was a learning curve for us. Hmm. Then you go for see, you can practice, you can do a lot of plastic surgery people, the reconstruction, they do the flap and graft reconstructions, commando surgeries, that's also in sync with oncosurgery. So you, if you're trained in that, you can practice that with your MSc degree. And of course you can go for fellowship. And if you want to practice only plastic surgery and you're that keen, you can go for a super specialty. You can go for an MCH, plastic surgery. Uh-huh. We, they do, yes. Yes, yes. Plenty, plenty. You can get your fellowships done from Tata Medical Center in oncosurgery. So, in fact, the current head of Tata Medical Center, he is an ENT specialist, even CNCI, MSCNT. So oncosurgery is a very big thing, is a big aspect. I myself, like this portion of ENT a lot. I honestly, I didn't have much an idea that ENT could play a big role in oncosurgery, head neck surgery. But after joining my residency, I've thoroughly enjoyed it, and somehow head neck prognosis is also good, and radiation oncology, our friends, there's a lot of combined effort. So, and the results are very good. You can keep that in mind after doing your MS or DNB. That's a very, very good opportunity. Yeah. Thank you, Shweta. No, yeah, yeah. No, definitely. Yeah, surely, surely. Okay. All the best, everyone, for your counseling. Thank you. Yeah. Bye bye.